Hello everyone, I'm Richard Conway from Dublin, Ireland, reporting from EULAR 2021 for Room Now. I'm here to talk to you today about a study that was presented in the opening plenary abstract session on Wednesday by Dr. Palomaki on MUC5B promoter variant and long-term incidence of ILD in patients with rheumatoid arthritis. So this was a population biobank study of 250,000 people. Among that, they had 5,500 with rheumatoid arthritis, and 178 of those had rheumatoid arthritis-related interstitial lung disease. So it's a little bit of background first. MUC5B promoter variant has been found to be associated first with idiopathic pulmonary fibrosis, and subsequently, when it was looked at in rheumatoid arthritis, also found to associate with rheumatoid arthritis-related interstitial lung disease. So these authors were seeking to better quantify the strength of those associations and the strength of the risks of MUC5B in the different populations. So essentially, they had four different groups. They had patients who had rheumatoid arthritis and had the MUC5B promoter variant. They had patients who had rheumatoid arthritis and did not have the promoter variant. Then they had non-rheumatoid people from the general population who had the MUC5B promoter variant, and they had people from the general population who did not have the promoter variant. And they looked at the risk of developing interstitial lung disease in those four different groups. Very interesting findings. So first of all, they found that having rheumatoid arthritis without the promoter variant was actually more strongly associated with interstitial lung disease than the general population who had the promoter variant. So 5.2% risk in rheumatoid arthritis without the promoter variant, and a 3.9% risk in the general population who had the promoter variant. And that's interesting because our perception of the promoter variant, the MUC5B promoter variant, is that it's quite a strong risk predictor of interstitial lung disease, but it seems that rheumatoid arthritis alone is a stronger risk of developing interstitial lung diseise. And then if you looked at people who had both rheumatoid arthritis and the MUC5B promoter variant, they seem to have a synergistic multiplicative effect. So it increased even further to 14.5%, which is really quite a high risk of interstitial lung disease. And then as the final kind of control, people in the general population who did not have this promoter variant, their risk of developing interstitial lung disease was 1.3%. So that's kind of the baseline risk, and we can judge that kind of step up of risks from that. So if you have the MUC5B promoter variant, you increase that up to 3.9%. If you just have rheumatoid arthritis on its own, you increase it up to 5.2%. And if you have both of those together, it's up to a whopping 14.5%. Which is, again, really quite a high figure. So how is this important? Right at the minute, probably not very much so, as we don't really know what to do with this information. But obviously, if we can identify this promoter variant in patients who have rheumatoid arthritis, we know which patients are perhaps more likely to develop interstitial lung disease. And that increase is probably at the level where if you could do something about it, you probably would want to intervene. We don't quite know what we might do in these patients to prevent interstitial lung disease from happening. But that space is also rapidly developing as we're looking at new treatments that might treat rheumatoid arthritis-related interstitial lung disease. It is possible that we will find an agent that it would be better for patients with rheumatoid arthritis to be on, that one biologic agent, for example, might be better than another one. And perhaps if we can check this promoter variant, and then we can choose a better biologic for the individual patient. And I'll be talking more about that in another video from this conference, so watch out for that. You can follow me at Twitter. I'm at Richard P.A. Conway. And please remember to follow Room Now for more updates from EULAR 2021.